the cloud.
Thank you.
My pleasure. Okay. Good evening, everyone. Thank you all so much for joining us today for the Anne Arundel County Health Committee meeting slash needs health community needs assessment or community health needs assessment. Excuse me. Our health committee chair, Dr. Ellie Gomez, is going to be leading this meeting. I am the president of the Anne Arundel County branch, Stephen Waddy, and we're joined by some guests as well, who will be introduced later on in the meeting. But I'm going to pass it on over to Dr. Gomez.
Hey, welcome everybody. I am very flattered to be invited to be a part of this and try to lead us towards having some kind of impact of use for the county, at least garnering our resources at NAACP with a directed motive and so that we can flesh out what it is we might be able to do of any real consequence. I thought it'd be a good idea to just, first of all, introduce this as a listening opportunity for folks and inviting folks broadly. That said, I am completely new to the idea of how we operate, really, and what the constraint on that is, and I hope Steve will help guide that, and then sort of invite any and all of you to contribute to the conversation and the things as we lay it out. I don't think anything that we're going to say is groundbreaking. I do think that I should give you the background that I've been fairly vocal in my community about what I feel are persistent inequities in health and in health delivery. As an ER physician, first of all, I find it pretty frustrating that I've been doing this for like over 25 years. And regardless of how I come at it, whether I try to have discussions with folks in C-suites or I try to influence policy at the local, state, and federal level, I have met some combination of surprise ignorance and disinterest, or at least not genuine commitment to ameliorating some of the things that we know have been going on for a long time. So that was my motivation to say, hey, Steve, I'd be glad to participate with the health committee, and what can I do to help? And then he invited me to chair, and so I said, okay, sure, I'll do that. So that's in the way of introducing what led to this moment. That having been said, I am just having the pleasure of meeting Gabriel Rodriguez at Centro de Ayuda and Kiana Banks recently at our recent meeting. Mary, Sky, and Stephen I've known for some time. And they know that one of the reasons I'm not a very good politician is because I tend to be overly frank. So because this is just our meeting, I don't expect to have any other type of interaction from anyone. And I think, all our hearts are in the right place. So yeah, let's get started. Did you want to add something to that, Steve? You're muted.
The only thing I wanted to add, we're grateful to have Dr. Gomez here. And again, as he said, I've known him for quite a while, and his passion is definitely something that is worn on his sleeve, and I appreciate it. the other thing I wanted to add was that we're gonna more than likely we have a soft stop at 9 o'clock, and so we do have some. Uh, we're gonna have a presentation, and then following the presentation, we'll have some responses, and then we'll open up for comments on this, as Dr. Gomez said, what the community is experiencing and what members of our branch are experiencing in this moment around creating a needs assessment for what we can do.
All
All
right, so let's
right.
jump right
Okay.
to the part the introduction to this thing. Um, I'm not about to reinvent the wheel. There's no insight that I have that hasn't already been explored heavily by Pamela Brown, who's an educator and researcher here. For the last 3 decades, she's been updating an assessment of the needs for the county. And let me see if I can get it on here.
Oh, okay. Did you
Or
want
do
to?
you want to do this one first?
Yeah.
Yeah. Go through this first, Stephen, and then I'll
Okay.
show that.
All right. Let me get to the side and share presentation. Okay. So yeah, we have our introduction to panelists. As you can see, the health committee's mission is to work to promote. Sorry, work to promote, protect, and defend the health of African Americans, um, assess the health needs of the community, advocate for equal access to health education, care, treatment, and research for all Americans, sponsor health-related activities such as health forums, fairs, and workshops, highlighting issues of importance to people of color, and support health initiatives of the association. And as you guys saw, our order of agenda. Um, this is Dr. Gomez, his bio here. Eli Gomez is a devoted father with a deep passion for social justice. After med school, he sought an MBA to address corporate greed in the healthcare industry and an MPH at Hopkins Bloomberg School of Public Health to improve clinical practice and organizational leadership in our state. He served as director for community health, emergency medicine departments, and consults for health equity in business. He recently accepted the chair of health committee for the Anne Arundel County NAACP to address racial and economic disparities in care for the underserved in our county, from accessing from access to algorithmic bias in medical decision making and institutional racism embedded in the system. He's a devoted father who, together with his better half, have 5 children and a beautiful granddaughter who all love nature and beaches.
Big on
Next.
the worms.
Thank you, Dr. We've got Gabriel Rodriguez. Gabriel Rodriguez is with us. He's the executive director of the Center of Help in Annapolis, Maryland, where he leads initiatives that provide educational, family, and mental health services to the immigrant community. He is also a member of the New Americans Advisory Council for the Comptroller of Maryland. With a Master of Music in Classical Guitar Performance, he serves as Deputy Director and organizer of the World Guitar Festival and Competition in Puerto Rico and as Director of the Guitars for Change program with the Baltimore Classical Guitar Society. With a background in nonprofit leadership, higher education, and the arts, he has secured vital funding, expanded programs, and fostered a strong organizational culture at the Center of Help. His work reflects a deep commitment to education, cultural enrichment, and community empowerment. And joining us shortly will be Thornell Jones. He's a physicist by training and a business leader experienced as a management and marketing executive at IBM. He's extremely active in social justice work and education for our county and state, largely responsible for the success of the Blueprint program to improve equity in public education. So I have the next slide I have, you guys can see. What's the current landscape of healthcare for people of color in Anne Arundel County. And what is a health needs assessment? So our goal with this listening session is to help identify primary health concerns for African Americans and others within the community. The Anne Arundel County NAACP needs to know the current health status of our members in the community we serve and other health needs. This and future listening sessions will provide critical information to our leadership and empower us to assist those in a position to make a positive impact on the health of the region's residents. The results also enable community members to measure impact and strategically establish priorities to then develop interventions and align resources. Here's some of our current health data that we have. Dr. Gomez, I'm gonna let you take it from here.
Yeah, sure. So the most important thing I think to take away from this slide is how life expectancies vary over areas just based on where you're located. It's not just access to care. It's a lot of different factors, right? What we classically refer to as the social determinants of health. Um, Sometimes not enough care is definitely negatively impactful, but it's not just a matter of how much care or how quick access, but really more what your lifestyle is, what preventative medicine you've been able to avail yourself of, and that'll come up again and again as we talk, I'm sure. But this is a map that shows the zips and how folks live longer in certain zip codes. That's sort of backward engineering something that is deeper, which is not just that they are generally more affluent areas, but that those folks have more resources and better life, healthier lifestyles, really. Some of this is really strictly cultural, and how we acculturate the things that lead to poorly controlled diabetes and hypertension, struggling with work and where to live don't help. The choice of making a healthy food choice, not just economic, but also cultural as well. And then violence, which some families and some communities are never really touched by, and others are so strongly impacted that our gun violence programs and our violence reduction programs and even our programs to mitigate drug dependence and such, all more heavily impacting those communities. So that those numbers are reflective of all of those factors. And do you have another slide, or is that it? So this is another slide that Steve shared with me. This is very similar to the work that Pam Brown has done, is catalog how heart disease, cardiovascular disease in general, but also cancer, disparately affects different populations by race. You'd think that cancer would be sort of a gimme, that it would negatively impact one group over another, but really it's a sort of it's such a long-term disease process that it's less likely to see issues there. When you have folks like when you look at zip codes, you'll see that zip codes more readily correlate with things like heart disease and cardiovascular disease. A lot of that comes from the way the lifestyle choices. The other things that are on here, the COVID rates are almost linearly associated with how people vaccinate. And the sample from our county is probably significantly different than nationally on average. but nobody gets off scot-free. COVID had a huge impact on all of us, a negative impact on all of us, but higher in the Black and Hispanic populations, not just here but everywhere. Um, and then sort of a common denominator you'd think would be accidents. I would wager to guess that the reason why you see the almost double rate in the Latin American community has to do with their occupations, and so they do hazardous work, and are more likely to get injured. And I guess evidenced by the bridge collapse, which I believe, if I'm not mistaken, almost all the victims were Latin American men that were working on the rig on the site.
We had
Um,
there was an African American guy on the bridge, was part of the crew who happened to run off right before it fell. So the employment discrimination that you speak of is key, you know.
mhm. So yeah, so that uh, kind of sums up what this one this slide has to offer. Um, you got another coming up? So okay, so this kind of gets to the meat of the issue. This is actually just a sample of SWOT analysis of health departments, and I believe this was taken from Michigan, but it applies to everywhere. So yeah, I wanted to get your sense. All the folks on the panel, actually, everybody here on the call. It's we might as well consider everybody here as panelists. Um, how you see our strengths. Um, Certainly, one of the things that I would name is um, we are pretty supportive of one another when we're present, um, as a culture, people of color. So I would name that as a strength that kind of runs through a lot of the items you'll see on here. Um, the things that I would say that are positive, um, um, strengths are a strong sense of family, sometimes very much in a community around church, and the weaknesses I would say would be the economic ones are a huge impact, and we already named work differences in work environment, um, limited infrastructure access. But then I think that a lot of issues around infrastructure weaknesses are really about access. Some years back, I brought up that even though the Department of Health has multiple clinics around the county, in and around Annapolis, which is where I live, when I visit these departments of health clinics, you'll see that one group accesses it and the other one has a huge temerity to access care. In a conversation with Claudia Barber this morning for a podcast, we brought up that part of it is a sense of distrust that a lot of our community has. And I get this loud and clear working in clinics and ERs when I see a Latin family or a Black family that's very grateful to have a doctor they feel they immediately recognize or identify with. And that's obviously not a common event. With the just one group, just to mention one group working on this on the Eastern Shore with the University of Maryland, there's only 3 Black doctors, and as far as I know, there's one or two, maybe the max Hispanic physicians. So it's unlikely that those situations will arise, and it absolutely has an impact on um, how folks are nurtured, cared for, how people go to bat for them. And then I would say that the opportunities would be you'd think that with all the talk about how we were going to invest in our in all of our community, we would see more impact for health services that have been lagging or lacking for our communities uh, for 30 years at least. And like I said, I've only been here 15. So um, mental health beds, that's a huge a problem. Detox beds, very hard to get help for folks that need it when they're not really affluent. And then threats is, in other words, things that might be negatively impacting us coming at the horizon. Um, our POTUS is making a speech right now, I think, about how he, proposes to curtail funding and support for our kids in college. And
Ugh,
um,
I'm sorry, I had a visceral reaction. You said that. It was like, ugh.
yeah, man. So the executive orders around modifying qualification for Medicaid, Medicare are disturbing. The stipulations around, personal, what should be personal life choices impacting that support is outrageous in my mind, but that's on the horizon as well. So we've got some challenges aside from what the goals we haven't met. Um, we've got some bigger ones coming around the corner. So yeah, so that's a good place to start. Before I start putting up any more slides or things, I'd like to get your feedback on what you're seeing in each of your corners of the world for maybe the top three things that that you would recommend need to be addressed in any particular order. Anybody that wants to go
Let's
is
let's start with Gabriel.
So, from my experience at the Center of Health, one of the barriers I've seen to address health issues is the is that usually minorities are placed into one pot, just minorities, and it doesn't work like that. African Americans and Hispanics have different needs. And I'll give you a very specific example. Um, the Anne Arundel County Department of Health we are partnering with them for a community health ambassadors program. And in that program, they have developed some goals for the program. One of the goals to the program is creating awareness about Narcan, provide Narcan training to the community. When I talk to the police department, if there is material in Spanish, they said no, we don't ever take into consideration investing in this because there is no cases among the Hispanic community for Narcan. This is not an issue for Hispanics. Um, so this is an issue for other communities, but Hispanics are not struggling with this. They struggle with alcoholism. So they have different needs. Um, so when you address health issues, you should not for minorities. I think is a big category, and minorities, depending who they are, they have different needs and should be addressed in a different way. That's one of the points I would like to raise.
Thank you. That's beautiful. And definitely very poignant. Um, Thornell, thank you for joining us. Thornell, I can't take you off mute. Here you go. You're
Finally.
off.
Okay.
I hear you.
So I wanted to say that I remember going to a community in South Carolina where one doctor, there's only one Black doctor, and that doctor didn't have anybody to take over his patients. He had 10,000 people that he was taking care of. I wonder if the same problem is not here, but in a different way. For instance, I wanted to get an internist. It turns out that all the internists are concierge doctors. So that means you got to put up a couple $1,000s to have that service. So if you have insurance, your insurance isn't going to cover that. So that's a difference in terms of the quality of care that you can get here. I also think that early childhood care is lacking. I spoke to a lady from the health department. She told me that she was in charge of visiting nurses. I asked her how many she had. She told me she had 3. And I asked what the workload was, and she told me 80 to 90 for each one. But something like 7,000 children are born here every year. So there is a lack of service for new mothers, new babies, for prenatal. I would say those are serious problems. And the result of those problems are that many of our children are not ready for kindergarten. And it's basic things about preparing your child for school. It really starts before birth. And so that's a serious health problem for our community.
I can speak to a couple of those different a couple of things from the practical standpoint of working in clinical settings, and I'll tell you that yeah, I mean, having the means to have the physician of your choice care for you is not an easy trick, and that when you have limitless funds, that's fine, or you have very the gold insurance and such, it makes it a little easier, but um, don't let's be clear, there aren't very many Black physicians in Anne Arundel County, and when you bring it up, folks are very quick to defend their their efforts, or so I guess that would be one way to describe it. Their years back, I was trying to find an internist with the internal medicine group here, and for AAMC, there are no Black docs that are in the internal medicine group. There's some specialists. We have an OB, we have a cancer doc. She's wonderful. We have a cardiologist. He's very qualified, but in terms of you trying to access a family practitioner or internist, it's not gonna be too easy. And the other thing is, folks tend to live where they feel supported, and that they're going to do the best for their children too. So a lot of Black physicians are they're resident in affluent areas in PG, or affluent areas outside of Baltimore, or affluent areas outside of outside of DC. They're not why would they come to Severna Park or Glen Burnie? And so, and I got to say that this is a similar situation occurs with Latin physicians too. There's not that many in any of these health systems. It's pretty rare to find them. So I feel your frustration. I think though I remember talking to Stuart, our county exec, about how do we address that? And during his campaign, he had tons of ideas, and I haven't seen anything, sort of put into effect in practical terms to attract, minority doctors to this area, to this county.
One of the things is that this county has a legacy of, we have Aris T. Allen and his wife, two Black doctors who cared for an entire community. And so that legacy that they have in Annapolis, specifically in the Annapolis area, is deeply ingrained in the people of Annapolis. In terms of they birth their children, and so many of them. And that experience is something that I heard about yesterday. That's how deeply ingrained it is. Yesterday I heard about that. It was a conversation yesterday at the Michelle Obama Awards, which Leah Green was a recipient of, thank God. And I see Dr. Hold on, let me her up.
Thank you. So
Okay.
obviously my perspective is going to be different, but I will share it. I have worked in medical device and pharmaceutical industry most of my life, and here are some things I've observed. Analogous to what we see in the school system. We're worried about equity in the school system. We're tremendously worried about the impact on our students, but we're also worried about the exploitation and inequity among the teachers and other employees. You got plenty of Black and brown people taking care of the grounds and the kitchens, but you don't have a whole lot of them up there leading schools, except Dr. Bedell and Mrs. Jackson and his cabinet. We are anomalous that way. So, and it's in both the hospitals where I go for treatment or the clinics and in the businesses I've worked in. I'll see Black people. They're from India. They're from Africa. They're not the descendants of the legacy of slavery. Not that I'm seen as frequently. So there are inequities in the profession of medicine that are also an equity issue for us. Gabriel once gave me a magnificent answer to the mental health problem. Puerto Rico is full of very competent psychiatrists and psychologists who cannot come here and practice readily. They can get here because they are U.S. citizens, but their degrees don't transfer. Same with Black people coming from other countries or Puerto Rico. You can come here, but your degree doesn't transfer. That's another barrier we know about. The second thing I want to talk about is, even though, as Gabriel pointed out, and as current folklore, community wisdom, and a few publications within the last 20 years in Anne Arundel County have pointed out, there's actually contention, hostility between Black and brown communities.
That's fair.
They both are facing inequities. So if I were taking this on as a systems analysis problem, I might say, what are the problems? But the next step, and the problems might be seen differently. The next step is to say, why are those problems there? What are the causes of the problems? And when I, with my mind alone, trying to perceive the societal solvable problems that give rise to the different inequities, those problems are very frequently the same set of problems. And I wanted to put that out there because I don't want the differences between impacted people to get in the way of our seeing that we can find solutions that serve everyone.
Has anybody been on the health exchange before? Thank you, Mary. I have.
Okay.
And I just, the health exchange in and of itself, I'll say this, for a long time, I have had no insurance. And so I would go through the health exchange when it first got created to get my insurance. And the process is not difficult. For me, it wasn't a difficult process for me to get the insurance. It was the maintaining of it that was problematic for me. You know, I could not keep the insurance that I was trying to get for on my own as an independent contractor, because it is generally insurance for a lot of independent contractors, from what I can tell. It's for the gig economy, and it's for people who are either getting paid under the table or they're not getting healthcare through their employer. And so that's one of the issues that I want to bring out, is that our access to healthcare for people who are 1099 workers is something that's going to be it needs to be expanded. It needs to be put forth in a way. When I was driving Lyft, when I drove Lyft, I talked to a lot of guys, a lot of immigrants, a lot of people who were recent immigrants and well-educated people. And that was their experience. Their experience of trying to get a health insurance was difficult. It was their income fluctuated because of how the gig employers try and scrap at your money. You know, they're scrapping at your money left and right. And so it's just employment wise, you know, it's that we have to decouple the the provision of insurance based on your income and your employment. Um, and I hope that we can find a space in this county to be able to try and there are subsidies available for depending on your income, but that's like Thornell said, it's going to affect the quality of care that you get as well. So those are thoughts that I've had, and thankfully teaching now I'm at the best of insurance, you know. So it's something, but it's something that's been you know, a constant strain. And the other side of that is there are a lot of people who are relying on their spouse's insurance and that raises their costs in order for them to be able to have insurance, especially in most necessary of times. Go ahead, Gabriel.
Gabriel has a question now. Oh, you're on mute.
Oh, sorry. And for Hispanics, more specifically Hispanic immigrants, I mean, it's not. I don't want to overemphasize. Everybody knows here that the health insurance is an issue for undocumented immigrants, but um, another issue, because they don't have health insurance, there are they're struggling to get primary care doctors. It's too expensive for them. So that we at the Center of Help have time and a time cases of people asking for financial assistance for surgeries, an oculist, for a dentist, orthopedics. Is people are desperately looking for those specialists at low cost. And when some dental clinics offer services at a slightly lower cost, they do not offer interpreters. So they cannot make appointments and go there and receive a service because they don't speak English. So it is the you have so many barriers. It's not only the lack of health insurance, but the lack of the language barrier, and also when you now add the immigration issue, we have seen cases of immigrants going to emergency room, and one once they are in emergency room, they see an ICE agent there, and they go back home. They don't want to risk being close to an ICE agent.
Yeah,
Uh, so there are so many
variable.
factors. It's even more complicated than just lack of health insurance for undocumented immigrants.
Before we go to Thornell, I want to say to a couple of the points that were brought up. One, to Mary's point, yeah, absolutely. There is, uh, you know, uh, racism built into the system that this basically doesn't encourage more physicians to, pursue work in areas like this, and they just stay in metropolitan areas where they feel more supported and basically safer in their careers too. So all these things are part of it. But the the things that Gabriel brought up, I wanted to address two of them. One, that I was very deliberately excited that he was going to be part of the group here, because I feel it's well past time that part of our effort at NAACP in the county is to be a unifying force between the groups, which we know have been divided significantly over time historically, and it's almost like folks want to hang on to the resource like it only serves one group of people. It's not true. Department of Health obviously gets influenced by whoever puts pressure on them, and the Latin American community is really not as organized politically to do that. I think it's incumbent on us to bring a sort of a unified voice to the needs and fight against divisive concepts like, well, Black folks die of overdoses. This is much more important. It's not that one is more important than the other. All such problems with dependency and overdose and getting health needs met are important. And really, it's an opportunity because the Black community struggles a great deal with alcoholism. I see it all the time in the emergency department. And so it's not an either or issue. So that's one thing. The other thing is, as far as language, it drives me nuts. The Department of Health feels that it does a great job of providing language services for care, and every time I don't know any of the clinics that specifically staff bilingual speakers. There'll be like one or two, like a tech, and they'll pull them up and they'll do some translating. But in terms of caretakers, and it's not that they don't exist. And yeah, the idea that folks come in from Latin American countries with some knowledge about healthcare and can't get a foot in the door, that's a big problem. And it's one that we can advocate for if we organize folks that we and advocate for people that would be able to participate on some level to provide this kind of service. Thornell?
So I have two things. One is I went to Greece. I hurt myself. I went to the pharmacist because it was late at night. Pharmacist took care of me. The next day, I went to the hospital. It was all free because we have the craziest medical system going on in the earth, on the world. And it all has to do with the profit motive and the American Medical Association and the pharmaceutical companies. So we need an overhaul, but I don't know if that's going to happen.
So as much as I really love the comment, let me add the one thing about what you said, and I'll let you second. that's that the AMA has lately done more for patient care at the primary care level than probably any other entity in the country. It's got a bad rap from the past, but what you're really looking at is for-profit hospitals. The problem is interventionalists and for-profit hospitals. They drive the inertia to perform interventions that are really expensive and they're very highly reimbursed, like hospitalization is. And so we have this tremendously expensive health system that is penny wise and pound foolish, because if we invested it up front on on routine care, we wouldn't have to have these ridiculously expensive interventions. So it's really not the AMA. Look to those big names that that run the health systems, and look at the CEOs of one of the groups that I'm gonna not name, but $5 million a year to be
Right,
a physician in charge of a health system. I don't think so. And they never see a patient? No.
right,
That's really
right.
not what it was intended to be. And so, but on the other hand, don't expect it to change anytime soon. So from the standpoint of what we can do, with this health committee, is educate folks on where to get care, how to get care. I'd like to talk more with Gabriel about what the barriers are to getting in the know about how to get care. Some folks in the community do a very wise thing, using urgent care clinics and avoiding the emergency department. The emergency department is probably the single most inefficient, expensive place to get care that you can imagine. And as soon as Medicaid becomes less attractive for hospitals to like railroad patients into so that they can excuse the care and get it billed, the sooner folks are going to see that this is not a wise way to use the emergency department. Mary?
So the other thing I wanted to say
Oh, I'm
was,
sorry, Thorne. Go ahead.
it's okay, that a few years ago, I was in an automobile accident, and I started having problems with my back, and I was all bent over and everything. A lot of pain. It took a whole year before they would operate on me. And I didn't think about it at the time, but I'm pretty sure they thought the pain wasn't so bad for Black people.
Definitely happens. Definitely happens.
And that's still a problem, is what I'm trying to say.
Yeah, you probably didn't have a Black doctor.
Sorry, Mary.
Actually, I've seen Kiana lean in, and I want to hear from her because you're front line in this. And then if I could get in line behind you, I'd be happy.
Thank you.
I'm finished.
Oh, I'm sorry. Did you say you were finished?
I am.
Oh, okay. All right. Good evening, everyone. So not as much frontline as you may think. I don't practice clinically anymore. I'm a nurse by background, but it's been some time since I've taken care of patients. I'm in the health policy realm and have been for about a decade now. But picked up shifts in the ER. I guess maybe it was within 6 or 7 years. It doesn't matter. But I do echo what was mentioned about mental health and making sure that there's availability of beds for patients who are in emergency departments needing mental health services. That's a long-standing problem in emergency departments. It was a problem when I was taking care of patients. It remains a problem today where patients are in emergency departments for, at least when I was in the ER as a nurse, I mean, it would be beyond a week, too long for patients to be in an emergency department waiting for an inpatient bed. So I think work in that area would be great, but that's a larger scope problem. And I didn't hear anyone mention anything about disparities that exist within the maternal health world, especially for Black women that are having babies in this country. There's a big disparity between what happens with them when they are pregnant and delivering versus others. So I think that I don't know what those metrics look like for Anne Arundel County. I am new to the county. I've only been here 2 years. So I would be curious. I would be interested to know if that is as much of a problem in this county as it is in other areas, sort of based on the national statistics. So.
I can speak to that a little bit. So in the last 5 years, there's been so much publicity and inertia around infant mortality and maternal mortality that JAACo and other oversight and regulatory commissions have brought useful pressure to bear on the major health hospital systems. So you'll probably see a lot of people like that are in leadership at those places point out like, look, our numbers are so good because they're very, we have similar outcomes for those communities. Oddly enough, the Latin American community always ranks high on infant care. And so that's something worth understanding and the whys and warehouse. But yeah, I think you'll find that the disparity gap in that area has been largely closed. The places where it's not, it's the routine care, like diabetic catastrophes, diabetic ketoacidosis, intensive care admissions. Those are like far more frequently Black and Hispanic patients than and the reasons are straightforward. Like they are pressured, social pressures, economic pressures, lack of medication, lack of follow-up, lack of routine care, lack of monitoring, and then not knowing where to get the care. Now, for instance, in DC, the system that I worked for, the med director for community clinic Unity, distributed monitoring devices for free. There was a program to do that in the community in Anacostia, and we saw vast improvement in folks like not coming in with ridiculous blood sugars and poor routine care. So they ended up in the ER less. But yeah, I think with reference to something that becomes like a national news, if Serena Williams were a Black man with prostate cancer, we would see a huge improvement in how care is rendered for men. But it really strikes me what Thornell said. It's very, very difficult to find a Black doc if you're a middle-aged Black man, and the care, I can't say enough. Like even and this because you worked in the area, is if there's a Black nurse in the Black family, they're going to speak a language that is foreign to the rest of the staff. And I don't know why in this day and age it has to be so damn foreign. With the Latin American community, I can tell you everybody brags about having translators. Oh no, we have a translator. I don't know who buys into this, but the translating systems translate verbally in to the same extent as you could in a telehealth visit with your doctor. Like, hey, I've got this rash. This is what's been going on with me. Can you send me medicine to the pharmacy? Like, no, really, it'd be better if you came and I saw you and I had a conversation with you and you told me everything that's going on that led up to this. This is my experience almost 100% of the time with Latino patients. They come in the door, the triage person knows what they have. They send a urinalysis and they come back to the room, and I find out they have a pneumonia, and you know what I mean? Like nobody, you're hearing the word that you're keying on as they come in with a complaint and not doing the situation justice at all. And so, yeah, these are the things I think perpetuate the disparity. When something gets a lot of attention, then the hospital systems act. If it doesn't get a lot of attention, you can bet that there is a disparity there.
Got 2 minutes. Go ahead, Mary.
I am going to take a look at what the Black Panthers did. I've forgotten what they did around healthcare. I was in California at that time, and I remember going to free clinics. I was actually married to a white physician who went to a couple of those. But there's something. The Esperanza Center out of Baltimore offers free clinics for Hispanic individuals. I think we can look there for a model. I have, especially this last week, talking with LE, lost faith in the structure, and I'm aware of the absence of attention to preventive care. I saw President Wada, you talked about health fairs. There's a Hispanic health festival once a year. You get a lot of free services, but it's not holistic. It's not the same as having somebody who's looking at you as a patient. They're selling whatever their organization has. They'll provide immunizations, et cetera. There's got to be a better model, and there's got to be an off-grid model that we can put in at a preventive level without having to be MDs, every one of us MDs or interventionists.
Let me,
That's
that's perfect. Thank you. Let me hear from Sky.
Hello, everyone. Ellie, congratulations on your position. You too, Kiana. So I see the time. We only have like a minute, so I'm gonna make it real fast.
It's a soft minute. It's a soft end. So you have time. Take your time.
All right, cool. Well, first of all, thanks for everything that was said. I appreciate all the information. And also thanks for putting up the mission of the committee. So here's where I want to help out. So number 4 of that mission statement, Thornell, you good? You waving?
I'm sorry, I have to leave.
Oh,
They're
okay.
putting me out.
All right. Take care,
Thank you,
Thornell.
man.
Good to see you.
Thank you. Great to see you again.
My pleasure.
So, and number 4 of your mission statement mentioned the workshop. So that's where I want to help out because I've been waiting to get busy with the health committee. So I'm happy to have you here because in my December report for the community coordination committee, I'm just going to read off the things that I have. Our committee talked about having mind, body, and soul series. So in collaboration with the health committee. So for the mind part would be to educate a little bit more. I have a Black history book that was gifted to me during the Black Entrepreneurs Expo. I think it was back in November. And also provide some LinkedIn learning courses, the public library tech help. And that falls in line with what we talked about with some of our members being challenged with technology a little bit. There are also Apple classes that are available at the mall. We could use that. As far as our body mall walks, I don't know if anybody's familiar with Girl Trek. There's actually a chapter, I think it's being run by the Deltas, but it is, I don't remember the day. I want to say Thursday. I remember it at the time. But they are doing regular walks at the Annapolis Mall. So that's something that maybe we can get involved with. And also I reached out, I don't know if you remember, but the gentleman who is a Black, that has self-defense classes is a Black gentleman, owns a place in Crofton. So I've been in communication with him. So I'm just ready whenever you all say, yes, we can do this. So we can get busy with that. Also,
yes, we can do this.
all right, good. And then also possible bystander training. So in the soul part, because I just covered the mind and the body, the soul part, there are emotional lunch breaks specifically for African Americans, and I got a chance to sit in on that. That was really awesome. I enjoyed that. And then I was thinking maybe we can invite the speaker. Her name was Adrienne Fikes. That's the only one that I've been to. They may have others, but maybe invite her whenever we get a chance to put together some series. And that's all I have. So I'm ready to go.
Well, I mean, we should probably start wrapping it up. But I got to say, the first thing that comes to mind is, I've got my thoughts about what might be of value, but I can't tell you how useful it is to hear all of you. And my hope is that we'll meet back here if everyone is, if folks are available to do it to the first Tuesday next month. same time, and then we'll add to the panel rather than, I'm glad I didn't bother trying to do Pam Brown's job summarizing her analysis of needs, because she can do it. Apparently she's willing to join us and walk us through that, hopefully next month. But thank you everybody for being a part, and please, all of us, let's keep dialoguing. Sky, absolutely. Whatever programs you have delved into, I think are worth our investment, especially hitting the ground running until we identify other things we want to put energy into. I think those would be great places to start. Our community, absolutely. Any sort of rooting we can do for their, modifying their lifestyle, both diet and exercise, and routine care, including meditation and reflection and timeouts, are essential for health. And Gabriel's point, I can't be more supportive of the idea that we, to my knowledge, have not done anything specifically for putting on deliberate communications or fairs or health communications around alcoholism and alcohol dependence, which I think is a huge opportunity for bringing the communities together.
I totally agree with you, and definitely also want to uplift maternal health and make sure that we address those issues around maternal health and all of the employment issues that you mentioned. Has been running throughout this meeting. We have to talk about that. We have to talk about our employment issues in this county and how to address, the racial disparities and the gender disparities at particular levels. And so that's something that we have to continue to address. And the zip code disparities, those disparities by zip code. So Dr. Gomez, thank you so much. Gabriel, thank you. Thank you, Sky. Thank you, Kiana. And thank you, Dr. Dudoni. So thank you, Thornell. And I totally love the idea of first Tuesday, and then I get my first Thursday at the Education Committee as well. So then we going, and then Friday we have the community coordination. Am I right?
Got it.
Okay.
Yeah.
So that first week
Somebody reached out, so they're gonna join it. Oh, you know what? I'm sorry. It's gonna be on Thursday only, but I had somebody reach out to me. They're gonna join. The only reason why we're changing it to Thursday because I have another commitment, and definitely proud to say BlurredCon. If anybody is interested, it's a bunch of Black nerds, so it starts Friday.
I heard Janelle Monáe's gonna be down there.
Oh, for real? Nice.
Yeah.
All right, you need to shoot me a text about that, because
I definitely will. It's just BlurredCon, blurredcon.org. Starts
I
this
love it.
Friday.
I love it.
And real quick, Mary, I accidentally gave you the thumbs up on anybody that wanted to join you for Baltimore. I was trying to give a thumbs up to the next one. I would, but my daughter surprised us. She came home today for spring break. So,
my
I'll
son is
find out
here.
when they'll have us up, and I'll see who wants to join me.
right.
It's okay. I haven't been there in a long time. Ellie, I think you have a committee.
Yeah. I
I
think
think we have us a convoy in case
Hold
you
on.
had to rescue.
Yesterday, Ellie, did you get Tatiana? Did you get a phone call from Tatiana from the email that Mary sent out?
no, it's
Okay,
it's a great email, but I haven't spoken with her.
Oh, okay. Oh, you talked to her email. You saw her email.
No, I saw the email. Yeah.
Oh, good. So she's got her public health as well. So
That's
that
who's
came
on our
from
committee.
Tatiana was on your committee too.
That's who reached out to me. Yeah, she's
Oh,
gonna join
good.
us on
Well,
Thursday.
we got to get Tatiana's ready. And so, we definitely got to get her to work. And then the Economic Empowerment Committee also is back up in action. And I'm looking at the Political Action Committee chair to see,
Getting it together.
Go ahead. Okay, all right, we're moving forward. I know it's a stressful moment for America, so take your time. Um, but yeah, thank you guys for joining us again. I did live stream this to Facebook, so I hope everybody's okay with that. You were forewarned. And I definitely appreciate you, Dr. Gomez, for scheduling this and making sure that we had everything together. So I look forward to the next meeting
All right.
and
Thank
everything in between.
you, everybody.
Have a good evening.
Take care.
Real quick,
Okay.
I dropped it in the chat, BlurCon.
Ooh, I see. Thank you.
Okay. I see it to me. I don't know if everybody got it.
Oh, I hope so. My apologies. Did it go to everybody?
No.
I don't see it.
Blerdcon.org. It's just BLERDCON.org.
Okay. Good night, y'all.
Good
Good
night.
night. Thanks, Gabriel. Thank you, Doctor. Thank you. Bye.